According to the World Health Organization, mental health is a state of well-being in which an individual realizes his or herself and abilities and can cope with the normal stresses of life, can work productively, and is able to make a contribution to his or her community. While mental health disorder, also known as mental health illnesses, refers to a wide range of mental health conditions. Dr. Ahmad Abubakar is a psychiatrist consultant. He works with Usman Nafodio University Teaching Hospital, Sokoto.
What can be considered mental health disorder is just deviation from what is normal. If it persists and it affects people, an individual's way of social relationship, way of living with other people, then it can be considered a mental health problem.
According to the World Health Organization, mental health disorder affects 13% of the world's population. The number could increase as people around the world shelter in a place and adjust to a new normal amid the coronavirus pandemic. For an estimated population of 206 million, according to the latest data by the National Bureau of Statistics, the World Health Organization says 1 in every 4 Nigerians, an average of 50 million people, is suffering from mental health illnesses. Findings show some factors contribute to the prevalence of mental health illnesses in Nigeria,
ranging from biological reasons, psychological and social reasons. Biological being conditions like genetic, like inheritance, that are part of what subject an individual to develop one or more form of mental illnesses.
Like every other health disorder, mental health ailments have their symptoms.
The symptoms vary, the presentation differ depending on the aspect of an individual's life that is affected by the mental illness. Some it has to do with emotion, like depression, anxiety. Some it has to do with the way they think, like schizophrenia, which is the most severe form. Yes. Some it has to do with as simple as sleep problem.
There is an unpopular belief that people with mental health illness may bring forth offsprings with mental health illnesses too.
Even though a lot of mental illnesses can be inherited, but it's not everybody that is giving birth, that's been given birth to a person that has one or more form of mental illnesses, that will eventually develop it. Some will escape, some will develop the mental illness.
It has been observed that some people suffering from mental health issues do not want to seek medical care for fear of being confined to a mental health disorder facility and also stigmatization. The consultant sheds more light.
An individual can go to any health center where he can access psychiatric care. Like in ideal setting, the mental health services should have been integrated by now, should have been integrated into primary health care setting. So people will have more access to it.
Aisha Bello is a 34-year-old woman suffering from mental health illness. She tells her story.
It all started when I got married. After I got married, I started receiving shout-out in my life. Every day you keep on seeing and hearing new things. The hurtful part of it is that from my own experience is that this person is actually aware of what he's doing. He could see that he's hurting me. He could see that he's driving me crazy. He could see that he's making me reserved. He could see that I was keeping away from people. He could see that I could even keep away from his relatives. Like for example, you have someone that you called your spouse, but look into your face almost every day, telling you why he regrets being with you every day. Looks at you and tell you every day because you look very deep into depression, you don't look well. There are days that I felt that I couldn't see another day.
Hawao, her sister, also narrates what it has been like standing by her sister.
I noticed that she was always restless and afraid. When you call her, since we are not living in the same place, so when you call her and ask her some questions, she will kind of lower her voice. And then I began to inquire, why are you lowering your voice? Are you at house? Are you out? No, she said, I'm at home. Why are you lowering your voice? I'm the one calling. When I was able to visit her at a certain time, I'd noticed that she wasn't sleeping at night. So many times she would wake up in the middle of the night and peep outside. So I panicked and I knew that I have to do something.
Dr. Muhammad Shuaibu Gubiru, Director Medical Services, Ministry of Health, Sokoto, tells us what Sokoto State Government is doing to reduce the prevalence of mental health illnesses in Sokoto State.
The state government is sponsoring some of its staff to study mental health so that they can come back and then treat some of the mental illness we have in the society. Like now, we have about 7 doctors training at a neuropsychiatric hospital to become consultants so that they can be able to come back with the state and manage patients with such illnesses. Additionally, many patients that were affected by this mental health illness, the state government is supporting their treatment, either at Udut or at neuropsychiatric hospital Quarry.
A Journal of Public Health in Practice of Science Direct revealed that the burden for mental health disorder is very high, with limited access to available and affordable mental health services in Nigeria. Naomi Kongwenda reporting.